Welcome back, party peeps. We're on the Decision Lab. Today we're talking to Dr. Tommy Wood. He's a medical doctor and a neuroscientist, one of 3 we've had on the podcast, which is interesting. His work focuses on brain health, longevity, physical fitness, physical activity, human performance, all things rife with misinformation. So I am pumped to get to chat with him today and go right to the source. Welcome to the show, Dr. Tommy.
Thanks so much for having me. I'm excited to be here.
Dude, the first question I have for you, okay, you are, like I mentioned, one of the few MD PhDs, right? So that means that you've done a lot of research, you've done a lot of clinical work, you've done a lot of like just learning in general. What I'm most curious about is when in that whole journey, were you in a flow state like the most often? Like you were just like dialed the fuck in?
Yeah, there's probably two main scenarios where that happened a lot. This is very typical of what a flow state actually constitutes. And this is another area with a ton of misinformation. Like people don't even know what a flow state is. Like they're constantly looking for flow, but they don't know what it is. Flow is the maximal expression of a complex learned skill. So it is when you are fully, like you said, dialed in to a complex task of some kind that you are, you have massive expertise in, or significant expertise in. The two things that like immediately jump to mind. One is I spent a lot of time during my PhD analyzing neuropathology slides from the experiments that we did, and it was quite repetitive, but still required significant focus and long stretches of time where you just had to like keep doing the same thing again, but like also be paying a lot of attention to like all the sort of details of the stuff that's going on. And then another time where it happens quite frequently is when I'm coding for statistics. I'm doing a lot of data analysis. That's a big part of my job. So like I'm in R. R is the programming language I use to do statistical analyses. So like just you're sort of like in it. And like, my wife sometimes mentions that like she could like lose me in R for like hours at a time, and I just don't realize like I'm just like in the code, and then I just look up and it's 4 hours later. And both of those scenarios actually, this is much more likely to happen if I'm listening to a certain music. So like I really like techno or drum and bass, and like particularly sort of like more melodic techno and drum and bass. I'm just like I'm locked in. That's what does it for me.
Dang, that's interesting. I wouldn't have expected. I guess I should have expected such a specific answer from someone, but someone like you. I'm much more people oriented. I get in the flow state when I'm in people. I could lose myself in a networking event, and it's like all of a sudden it's so late. And I'm like, oh, what happened? Do you find that to be the case? Is that true? Can people be in flow with people versus like stats versus?
Yeah, absolutely. So flow doesn't require you to just be on your own, right? Focus on a single task. Another area where flow often is thought to happen is in group settings, like where everybody's working on the same task. You're sort of like brainstorming, that kind of stuff. That is another area where it happens too. So that makes perfect sense. And then it's always going to come down to like, what are the skills that you're expert in? Creates the arousal state that flow requires, right? You need optimal arousal for flow to even happen in the first place. And then you as a person, what sort of gets you into those states. So like networking events, hard pass for me. Thanks very much. But give me some code on a computer and I'm all in. So, but that's just based on different personalities and different skill sets, right?
Yeah, 100%. Tell us a little bit more about your background. You've got so much that you've studied. Flow sounds like a tiny little drop, but what else have you kind of looked at or been interested in?
Sure. So I can give you like a flavor of all the things that I do now, which is kind of like the outputs from spending most of my life as a professional student, which is essentially what you have to be if you do an MD PhD and all this other stuff. And I did in the long way round. I did everything separately. Like I didn't stack them together like you can do. So my main day job is as an associate professor of pediatrics and neuroscience at the University of Washington. I run a big basic neuroscience lab. My group studies ways to treat brain injuries and for some types of brain injury, potentially prevent brain injuries. We're working to develop some devices that might help to prevent concussions and traumatic brain injuries from happening in the first place. And we do a lot of work in the developing brain. So trying to treat babies with brain injury that happen for a variety of reasons. Then I also do work with various athlete populations, so primarily in Formula One. So I'm a performance consultant. My job title is head of science for motorsport for a company called Hinton Performance that supports the majority of Formula One drivers on the grid in any given year. And so actually my job is to do kind of a similar job to you, which is like these guys are getting pitched stuff all the time. They're listening to all the podcasts, all the supplements, all the tech, all the gear, like, and they come to me and they're like, hey, Tommy, like, is this even a useful thing that I should be considering? So in that world, that's kind of what I do. Also do some work, in other sports. NFL, I've worked with world champions in triathlon, running, various other Olympic sports. Those areas kind of come together, the different brain injuries, all the different aspects of athletic performance, they've kind of increased my interest in, well, how do we maintain brain health across the entire lifespan? So now I spend more and more time looking at the factors that influence cognitive decline and dementia risk. And so I'm head of research for a dementia prevention charity in the UK called Food for the Brain. They have a big database of more than 500,000 people who've done cognitive function tests and a whole bunch of lifestyle questionnaires. We're doing some research from that. And then I'm chief science officer of a company, a brain health coaching company here in the US called Better Brain. And their brain health coaching platform is now actually available to most Americans through their insurance. So you can get like cutting edge brain health coaching through Better Brain, now available to most people, and I sort of help oversee the science for that. So those are most of the different areas that I kind of get to play in nowadays.
When do you sleep, big dog?
Do you know what? If I don't sleep, I wouldn't be able to do any of those things. So like I'm in bed 9 hours a night. Otherwise I can't function.
I feel you. I am the same way. It's nuts. Something I'm curious about that just popped into my head. I was a college athlete. I got 4 concussions when I was playing. So it's like, holy crap, like you're studying the stuff that is important to me. But in relation to athletes, I'm curious, in relation to elite performance, how much of, because there's all these like 20 somethings that are like, oh, if I had worked harder, I could be in the NBA or the NFL or whatever. In your perspective, like how much is like nature versus nurture? Like how different are these athletes, these elite performing athletes physiologically, or do they just work harder to get there? What's the difference? And mentally too, honestly, not just physically.
Yeah, so across those 3 areas, I think all of those things matter. And there's going to be some genetic, some baseline physiological component, right? You're 6'6", I'm 6'2". You're much more likely to have been an elite level basketball player than me, right? Because those extra inches matter. And so sometimes like your body height, body type, frame is going to affect how you perform in a given sport. So I was a rower in college. I'm getting weirdly specific here, but I have the torso of somebody who's 6'6", but I have the legs of somebody who's 5'10". And when you're a rower, your femur length matters a bunch. So like I would get, because like physiologically I was pretty fit, I was pretty strong, but my coaches who were like international level coaches at times were like, man, if only your femurs were 3 inches longer, like you'd actually be a really good rower. I'm like, well, I can't change that. I have no control over it. So some of it is going to have a physical component, just like based on your frame. Some of it, right, there's a genetic component to most aspects of performance. It's probably less than we assume, but some of the best, say, Formula One drivers, they're probably towards the top end of the bell curve on like reaction time and some other things that those can be trained and those can be supported. I think we can all improve in that area if we really focus on it. But like they probably just happen to be at the upper end there. So that's going to be important. We know that processing speed, reaction time, these all sort of like fall on the bell curve, right? So you need to be at the upper end of that bell curve just to sort of be in the mix. But then everything else, I think, is probably very trainable. And the thing that I'm most interested in is how lifelong skill development, well, I think is like a fundamental component of how the brain functions. And so the reason why, again, we'll use Formula One, why the Formula One drivers are Formula One drivers is because like that's all they've done, right? Yeah. Since the minute they could sit in a go-kart, they were racing go-karts. And then they did that every day, weeks and weeks and weeks and weeks and months and years, and then worked their way up the categories. And yeah, like you need a lot of money to be able to do that. You need sponsorship. You need the right kind of socioeconomic environment. That's a big reason why there's like a certain demographic of people who make it into Formula One. And then, you need to have some money behind you to even get a seat, right? Because it costs millions of dollars. So some people just, they sort of like pay their way up to a certain extent, but you do need the skills to do it. But like all they've done is race cars. And so I think we don't do ourselves justice when we say, oh, this guy is just like he's just like a physiological freak. Like his brain is just different from mine. Like I could never do that, right? You could do that. Just circumstances meant you didn't have the opportunity to like immerse yourself in that world. So like I think most of those skills can be developed to a very high level for most people. But then the psychological component is important too, because you have to be willing to fall in love with the process, right? Because you're going to lose and you're going to make mistakes and you're going to fail, and you just have to keep coming back and figure out ways to sort of like deal with that and be psychologically resilient. A lot of that involves not just like knuckling down and pushing through, which is kind of how it's sold. It's more like mindfulness, self-compassion. That's what really works to help build that sort of psychological resilience. But you need all of those pieces to come together, really, to sort of like see that elite level performance.
Yeah, that's interesting. Something you mentioned is like getting that feedback rapidly, kind of connected in my brain back to a flow state. I don't know how much you appreciate like Stephen Kotler and some of the work that he does, like the flow state institute or whatever. But one of the things he mentions, and I'd be curious to hear your perspective on this, is to get into a flow state, having fast feedback. Like when you're doing R, you can see, click the thing, oh, there was an error, or oh, it worked, fast and rapid, and being able to have that fast feedback. Is that something that is a flow trigger?
So there's a few different parts to that. One is that, yes, I think fast feedback is incredibly important. But when you think about some of these like what I think of as like the truest flow states, though, is when all of this is happening and like you can almost step back and be like, my body and my brain are doing this, and I have no conscious control over it. That's a true flow state. When you're making mistakes, making errors, getting that rapid feedback, I don't consider that to be true flow. And part of that is because if we consider flow to be the maximum expression of a learned complex skill, then you are making the most of the capacity that you already have. Right? You're making the most of the skills that you've already developed. Whereas if we're thinking about skill development and getting better over time, that requires making mistakes, that requires feedback, that requires learning. But that creates a level of discomfort that is almost anti-flow. It's not a bad thing, right? It's important, right? So like as you make mistakes, so the brain is always trying to predict an outcome. And so mistakes are a difference between expectation and reality, right? I think I should be able to do this and I can't, right? That creates a sense of discomfort as you release dopamine, noradrenaline, right? There's this friction there. And then that's what drives neuroplasticity. So I'm not sure that true flow states actually drive neuroplastic change in the brain. I think you're taking maximum advantage of what you've already developed. But if you're trying to expand capacity, that's going to create that's going to be failure, mistake, discomfort, which I think is almost antithetical to flow, but that's not a bad thing. That's just like, that's the state that we're in when we're actually trying to push the boundaries and get better.
It's interesting. Because I think of something like surfing, for example, like there's a level of like prediction, error, correction, your brain, your sensory motor system has to be doing constantly so you don't fall off the thing. So it's like little micro failures. But you're saying that nosediving into the wave over and over and over again that's not flow.
Yes.
But that little tiny refinement in your ankle, for example, you could still be in a flow.
Yeah, but in that first example, that's not under conscious control. Like if you were thinking about those micro movements, right? Already you're behind the 8 ball, you're going to fall over, right? So that is your brain doing these things because you've already learned how to do it. So that's where I see the difference in my mind. So yes, you're constantly adapting to the environment, but you're not doing it consciously. So that's the difference between flow states and clutch states. So a clutch state is probably more common in elite sports performance, where you are performing at an incredibly high level, but it requires significant conscious effort, right? And that's the real difference. And both result in high levels of performance, but like the subjective experience of them is quite different. So I think that's how you kind of separate those things out.
Damn, that's cool. I love that. I feel like most people still don't understand how predictive our brains are, which is just, I love that. I love to get to talk about that kind of stuff. Speaking of brains, you also deal with baby brains. You are on the full spectrum, my friend, which is wild. How, and just real quick, which piece of your background, are you like a pediatrician on the MD side, or did you study children's brains on the PhD side? Like, where did that kind of come in?
Yeah, so I never completed my medical training, and I don't work as a clinician nowadays. Like I have medical training. I did work as a doctor for several years, but then I did my PhD and then I moved to the US, and the process of trying to I basically had to start residency from scratch. I sort of, and all that kind of stuff in the US because all my training was in the UK. It was just like too much hassle to do it. So I get to use those skills in other ways. But when I was doing my medical training, I was I had a lot more experience in emergency medicine, internal medicine, right, in adults. I did some fun toxicology work because my hospital was like right in central London. St Thomas's is right opposite Big Ben, like the Houses of Parliament, the London Eye, like it's right there.
Wow.
And just down the road from St Thomas's is Vauxhall, which is like a very well-known clubbing area. So we would like go down there at like 3 a.m. and like ask people about all the fun things they were taking, which was interesting. And so I was much more adult focused in my medical training, but then it was when in my PhD that I went sort of neonatal and pediatric. So that's where that expertise came from, and it was because I'd done some work in this lab a little bit as an undergrad, and then when I was trying to figure out exactly what I was going to specialize in my medical training, I got an offer to do a PhD in this lab. So that was when I sort of switched over, and that added that part to my resume.
And so what types of things were you learning about baby brains? Like we talked a little bit about flow state, we talked some about that stuff, and I know you study the opposite end too, which we'll get there. But what kind of stuff are you looking at?
Yeah, so we study two main types of brain injury in babies, and I have a lab where we do this in animal models and various different ways to try and develop and test new potential therapies and combinations of therapies, because we kind of, one thing that is definitely you could take away from most recent neuroscience and neurology research is that like one drug for one condition is probably never going to work, right? You might need multiple things to happen at the same time. Different regions of the brain respond differently to different therapies and different injuries, and it's going to be really tricky to sort of come at those from multiple angles. And then I also, like I mentioned, I do a lot of statistics for like clinical trials and clinical data sets in those same scenarios. I'm like with my colleagues who are looking after these babies. But the two main injuries that we look at, one is preterm brain injury. So if you're born early, you have a higher risk of some kind of neurodevelopmental impairment, something like cerebral palsy, or some other kind of cognitive deficit. And the more preterm you're born, like the more early you're born, the higher the risk. And then we also look at something called hypoxic ischemic encephalopathy, which is when baby, everything looks fine up to the end of the normal pregnancy, like everything's expected to be perfectly normal. Something devastating happens usually during childbirth. And so, there's significant blood loss from the mother, or like the baby gets stuck or something like that. And so essentially there's a period of time where the brain isn't getting enough blood flow and oxygen. And so there's a well-defined treatment for that, therapeutic hypothermia. So you cool the baby down for 3 days. That significantly reduces the risk of death and disability, but it's not a cure-all. So we're finding ways to sort of add on therapies to that. And there are certain versions of that injury where hypothermia doesn't work, and so we're trying to find separate therapies that would work in that scenario. So those are the two broad categories that we work in.
Man, it's got to be emotionally intense work at times. I would imagine, especially for the people who are like taking care of them. Not that looking at the stats is like you're devoid of emotion, but still, that'd be tough. Is there anything that you'd change about modern like prenatal environment that would like support long-term brain health or resilience the best? Whether it's like hospital policies or prenatal leave or sensory exposure, feedback practice, any of that stuff.
Yeah, it's a great question. I think, it really depends on the kind of the scale that I would be allowed to work at. Access to high quality prenatal care and perinatal care and support would be like number one. And unfortunately, that's not something that everybody gets. And because then that allows you to figure out like who's going to be at risk, have them in the hospital so you can look after the baby immediately. That would have massive payoffs if we could achieve that. But then there's a whole bunch of other stuff that we know matters. So maternal health, diabetes, obesity, that influences the outcomes for the baby. Like nutrient status influences it as well. Like providing those kinds of things, and the more we could do to fix sort of like population health, that's going to have a massive impact too. And then what's most interesting to me, especially I sort of mentioned earlier how I think skill development or essentially exposing the brain to novel stimuli to kind of drive learning and neuroplasticity. I think that's the most important thing for determining brain function. What we see in these populations of babies, and it's true for both of the scenarios that I mentioned earlier, is that yes, what happens in hospital is super important. The care that these babies get is super important. It's improved massively over the last 50 years when neonatology, so the practice of looking after sick babies, only really started in the 70s, because that was when they really started to learn how to keep these babies alive. And so there's been massive improvements in that in the last 5 decades. But when you look at what affects the outcomes of these babies in terms of cognitive function, you could do these standardized cognitive function tests for toddlers or young kids, which they do in these studies. The most important thing is the home environment that baby goes home to. So a whole bunch of terrible stuff can happen in the hospital. If that baby goes home to, loving, supportive, low stress environment, and that's usually determined by socioeconomic status, you can overcome a lot of the potential risks that you had in the hospital. So being able to create an environment where every kid goes home to that kind of environment where they get high quality nutrition and there's few stresses and they get exposed to a bunch of different things, like they're reading and playing and they get to take part in sports and all that kind of stuff, that would have the biggest impact. Because and we see that from the data, that's the thing that really determines how these kids end up doing.
Man, I feel like that is such a representation of when is that not true? For what brain?
Yeah.
Your environment,
Exactly.
your entire life is so freaking important. It's why the saying, you're the example, or if you're around 6 millionaires, you'll be the 7th or whatever. Is that ever not true? That your environment is that powerful on your brain and all outcomes?
No, I don't think it's ever not true. And so I've got a book coming out in a few months, and I think part of the story that I tell in the beginning of the book is that we don't really understand the brain that well, if we're honest. And I'm a professional neuroscientist, and we don't, as a field, understand the brain as well as we kind of tell people or make people think that we do. But if there's one thing that I'm confident, is that the brain is a product of its environment, right? And the environment is ideally something you can change. And then if you can change your environment, you can change your brain. I don't know much else that I'm confident that I know this, right? I think I know stuff, but I'm confident in that because in every scenario that we've talked about and many more, that absolutely seems to be the case.
Right. Literally. It's so interesting. I feel like people forget about that, how much it shapes their identity, and then it shapes their internal model, and it just freaking takes off and people don't even think about it. It's freaking nuts.
So I have a nice example of this. When you look at some colleagues of mine, this was actually several years ago before I did any work with them, but there's one group at Washington University in St. Louis, and they looked at the regions of the human brain that are most evolutionarily recent, right? The regions of the brain that are basically uniquely human compared to other species, even other primates, in terms of development. And then they looked at the areas of the brain in babies that are the least developed at birth. And those areas of the brain are the same. And so what it tells you is that the areas of the brain that are most complex in humans, that are responsible for our most complex cognitive functions, are the areas of the brain that are essentially blank slates at birth, because that brain is just waiting for the environment in order to develop and know what it needs to be good at, what it needs to, the connections it needs to make, the skills it needs to have, right? And so that's one thing that's unique about humans, is those complex areas of the brain are essentially very underdeveloped at birth compared to other species, so that we can respond to the environment and our brains can adapt accordingly.
The Decision Lab is proud to announce its first sponsor, Apollo Neuro. They are not only TDL approved, but Chloe and I have been using these for years. You probably heard us talk about them and show you our Apollos on the podcast, okay? If you fall asleep fast but wake up at 2 a.m. with your mind racing, or your wearable keeps telling you that you're stressed without actually helping you, the Apollo is for you, okay? It doesn't just track your stress and sleep, it helps you take action. It's built on a decade of research, which we break down in depth with the founder, Dr. Raven, who is an MD, PhD, on the Apollo episode that we have with him. Apollo learns your stress patterns, calms your nervous system in real time, and helps you stay asleep. Users get up to 60 extra minutes of sleep per night, plus 40% less stress and 25% better focus. Apollo was just featured in Forbes for their vagus nerve science, and they just published a new randomized pilot study suggesting it is the first wearable that helps prevent burnout. Freaking crazy. Go check that out, okay? Decision Lab listeners get $90 off. Hit the link in the description, grab yours. I'm reading a book by Dr. Ben, uh, science communicator, but also like a Stanford neuroscientist, and it's Why Brains Need Friends.
Oh,
And he
Ben
talks
Ryan. Yeah,
about,
he's a good friend of mine. Yeah.
oh, dude, yeah, he was on the pod too.
Yeah.
I love that guy. He's awesome. He just had a kid too. Speaking of babies, shout out to him. But in relation to, in his book, he talks about, I always forget the specific name, but there are like these zones as you're growing up that are like hyperplastic moments. He talks about social connection and like obviously like skill develop or like communication and like interpersonal like skill development and stuff like that. It makes sense that our brains would do that. So that's interesting. In relation to concussions and TBI, I am curious. Speaking of the developing brain, obviously in traumatic brain injuries, there is the physical component of like brain is hurt, like damaged. For sure. I'm curious on like what you've researched or seen in relation to like the psychological side, and then how that feedback loop feeds back into the physical side. Because I can tell you, like I was a college basketball player. Went from starting to sitting on the bench with no cast, nothing, and I look fine on the outside, but on the inside, like I'm puking in the morning. I can't focus in class. Lights feel like I'm getting shot in the head, like which messed me up psychologically so bad. And I'm curious if that's something you've seen or studied or looked at.
So that the specific sort of psychological aspect of concussions is less my area of expertise. I'll admit that up front.
Fair.
But I think that sometimes these things are very difficult to separate. Often what we think is psychological is just an ongoing injury response in the hardware of the brain. And it's funny because like as neuroscientists, and even like I know neurologists who work with concussion cases like all day, every day. It's like their area of expertise. People are trying to disentangle these things all the time. Like, is this actually a concussion, or is it just like a psychological anxiety response to the injury? But like, I don't know how well we'll ever be able to actually do that, right? Because all of these things are happening in the same person at the same time. If you can do that, of course, it might help you figure out, well, how do I address the individual symptoms that this person's experiencing? Because some might be, well, I have to do, you could do some supplements or drugs or whatever, right? Because you're sort of like treating the tissue, the hardware of the brain. And some might be, well, actually this kid needs to see a psychologist, and maybe therapy is going to be helpful, CBT, something else. But equally, we know that if you do psychological interventions, that also changes the hardware of the brain, right? That can change stress responses, inflammatory responses, that affects physiology. We also know that how we think directly affects our physiology. So if we're like, I'm injured, I don't expect to do well, right? You won't do well because you essentially manifest it in your physiology. And that sounds like super woo-woo, but it's like, it's really well documented. We know that how we think we'll perform influences how we do perform. So it's essentially just like really tricky to disentangle all of these things, and just worth bearing in mind that it's some of that expectation and some of the psychological impacts of these injuries that then have a direct effect on physiology and performance because of the way that our thoughts affect how our body then responds.
Yeah. My favorite area of research for this exact reason is like psychoneuroimmunology or like psychoneuro, like endocrinology. Like, do you happen to know anything about those fields, or have you met anyone that like looks at that or researches that? I've struggled to find someone.
I think it's not directly related to concussions, but it is related to the impacts of social connection on health. So like overlaps a lot with Ben Ryan's work. A couple of years ago, so I'm an editor for a journal called Lifestyle Medicine, which is published by Wiley, so like a science, proper like academic scientific journal. And a couple of years ago, we had a special issue on the effect of community and social connection on health, that I did with a friend of mine, Julian Abel, who's a retired palliative care physician, and that's really his expertise. Essentially completely changed communities, including the healthcare setup, and seen by just increasing connection between people, and seen dramatic improvements in like the whole population health. Like it's super
Amazing.
cool. So he did this in Frome in the UK. Now they've done it in multiple other, people have replicated this in multiple other cities. Like Colombia, the country is doing a lot of similar work. And so we kind of got lots of experts together to write papers on this field. And so one group, UCLA, George Slavich and Steve Cole, they would be important names to look up. They've done some super cool work in this area. And what, their paper that we had in our issue basically talked about how the body responds to changes in the social environment. So when you are when you're like socially supported, you're living in a group, your immune system does one specific thing. So it becomes really good at like responding to viruses, right? Because you only get exposed to viruses if you're around other people, right? So like you only get a cold or a flu because there was somebody else who had that in your environment who gave it to you. When you become socially isolated, maybe because of the stress of the isolation, maybe because of the loss of the sort of the benefit of being connected to other people, maybe a bit of both, right? Your immune system shifts. So you have a higher baseline of inflammation, and this is beneficial in the short term because actually you have like faster wound healing. So like, because if you're, to like really simplify it, if you're alone and you fall over and you cut yourself or whatever, nobody's there to help you. So your body is like on higher alert and it can deal with these things slightly better. But if that response is activated long term, that's associated with higher baseline levels of stress, higher sympathetic nervous system activity, higher levels of chronic inflammation. You can measure it like with like CRP, IL-6, other things, and then a higher risk of depression, cardiovascular disease, potentially dementia. And where this becomes important in the modern environment is that you can see some of these same stress responses from how people respond to online social connection, like social media, right? Because all of it is based on there are many different ways to create social stress. So that kind of like stress response, inflammation response is essentially a response to social stress. And in many ways, social media and other ways that we communicate with people online is socially stressful because you see all these other people, richer, happier, more jacked than you are. And what you do is internally you demote yourself. You like decrease your social rank. And that is a social stress. So there's just this, you kind of see this mirror between like what happens to the body when it's socially isolated or lonely to how we respond in these sort of like more modern social environments, which I think is super interesting. But also, then we need to be mindful of like, well, how do we interact with these technologies because they could actually be affecting our long-term health, and we're just like right at the beginning of trying to figure that out.
It absolutely does. So I work in the dating space a lot. Like I'm specialized like with attachment trauma, helping people after heartbreak but before dating again. And one of the last barriers people have to overcome as they get back into modern dating is exactly what you're talking about. All of this bullshit on modern dating is terrible. Guys don't want this, girls don't want this, all of this stuff.
Yeah.
And they just misunderstand how that's affecting their have you heard of or seen the research from, I think it was out of the Netherlands, where on expectations,
like specific types of expectations, or
well, they had people go into a lab, they played white noise, and they asked them, anytime you hear the song A White Christmas in the white noise, press this little red button or whatever, 2/3 of the participants click the red button at least once with 80% confidence, even though the song never played a single time.
Okay.
And so when you think about stuff like that, and you think about everything you just said, all the stuff that I just said, people literally are creating these realities that suck for themselves because their brain creates reality through expectation, and they misunderstand that.
Yeah. Absolutely. And this actually, so this relates to the other, so this does finally kind of relate to some of the concussion stuff and other things, because you see this expectation and how it affects psychology, how it affects physiology in multiple different areas, right? So one that I talk about quite a bit when we're thinking about, like, we know that sleep is super important for the brain, but there are several studies that show that you can manipulate somebody's experience of their sleep and it will affect their performance regardless of, even if they slept really well, right? So if you make them think they slept poorly, they will perform less well because they're like, well, I didn't sleep well, so I'm not going to perform well. They don't perform well, but actually they slept just fine. So this is like another, there are so many areas where what you expect to happen does happen, and you can measure it in physiology, you can measure it in cognitive performance, but it's all based on expectation.
You are the perfect person to ask this question to, because the number one freaking little devil in my life at time is this freaking Whoop device. I swear to God, I feel like I slept like the Father Time himself, dude. And I wake up and my recovery is red and my sleep's go, oh, you didn't get enough REM. I'm like, dude. And then it just wrecks me mentally. And I'm like, I will not let this affect me. I will not let this affect me. But it does. Drives me crazy. So I know the drama. I get it. But my question is, you are someone who studies data. You look at data, you look at biometrics, you look at biomarkers and things like that. How do you balance what you show a human to help them perform better and live longer and like all the stuff, versus how do you balance that to not have the experience like I'm having with Whoop?
Yeah, so it's a great question. And do you know what? I like sometimes I'm a little down on wearables, but like I have lots of friends who work at Whoop. I think like the technology is incredible. They do an amazing job. They do great research with their platform, but there are absolutely
it's a love-hate relationship.
Yeah.
I agree.
Yeah,
I
yeah,
agree.
right. But there are downsides for certain people with the technology, and I think it's quite common, right? Because humans are not rational beings. We can't just like take this information like dispassionately and say, okay, well now I know and I'm going to do better. Humans,
Right.
we don't work like that. So one part of like collecting data and trying to understand it and act on it is understanding sort of either the fidelity, the accuracy, or the usefulness of that individual piece of data. I do a lot of work with blood tests. I do a lot of work with wearable data. One thing you need to know is how well is this thing actually measuring the thing that I care about, right? So an example, like we always assume that the number that's in front of us is the truth, right?
Right.
But like
That's
for
true.
most of these things, that is not the case, right?
Right.
It is everything we measure has an error, and some things have bigger errors than others. So a good example is, say, testosterone in men, right? Everybody wants more testosterone, even though that's probably not necessary and maybe not a number worth chasing. But so imagine, we can talk about that more if you want. I saw you like tilt your head. So imagine your testosterone is 600, right? There is so much individual biological variation. Like your testosterone fluctuates through the day. It fluctuates across the year, right? And there's error in the measurement, right? So much so that if your testosterone on one test is 600 and then you measure it in 3 months' time and it's 700, your testosterone might be exactly the same at both of those times, because of just like the natural variation and the error in the test. So you might be like, my testosterone went up 100 points, like I'm so much manlier now. But actually, it's all just within the same distribution of data, right? So you need to know like what's the error and the variability. So like, is this actually a change from before? So that's one part. Another part is how well am I measuring? How well am I measuring the thing I think I'm measuring? So one thing that wearables are not good at, and these are published data, like I'm not like just like ragging on wearables, is they are very bad at telling you what stage of sleep you're in. Even the most recent ones, like deep sleep in particular, really bad at. Like it's not quite 50-50 crapshoot, but it's like 60% accuracy maybe at best.
I already feel better. This is great. Keep speaking. Keep telling.
So one thing that I would use those data for is like, what was your sleep opportunity? Like, how much time did you spend in bed? Because actually, that's a variable that that is probably the most impactful to manipulate, right? And I've seen this again and again, even in elite performers. They're like, man, my wearable tells me I'm not sleeping well. I'm not getting any REM sleep. And I'm like, well, you only spent 5 hours in bed. What do you expect? That's an easy number to understand. But one thing that they're probably better at than exact sleep staging is just because there's error there, like because it's based on it's not based on heart rate, it's based on pulse rate, which is not the same thing. So it's looking at pulse rate, it's trying to figure out like when you're in deep sleep, and there's some other things like body temperature and stuff.
Time out. Wait. Heart rate versus pulse rate. Let's just double tap on that just really briefly before you go off on your thing. Like,
yeah. Sorry, when a wearable will tell you they're measuring your heart rate variability, right? This is or your heart rate, right? And this is like a core feature of physiology that we know is helpful. Heart rate variability tells us a lot about our physiological state. It tells us particularly about the physiological cost of a future effort, right? It doesn't predict performance very well, but it says, how much is an effort going to cost me physiologically? So if your heart rate variability is low, doing a significant training session or something is going to cost you more physiologically. So like heart rate variability is very useful for that. But it's mainly useful as a trend over time. Like the day-to-day variation is so much that like you'll drive people crazy trying to look at it on a day-to-day basis. And like the best HRV people are like looking at trends over weeks or months because kind of tell you how you're sort of like changing over time. But when you're measuring heart rate or heart rate variability with a wearable, it's usually around your wrist or it's a ring on your finger, right?
Mm-hmm.
So heart rate and heart rate variability, you can only measure through electrical activity across the chest, right? What you're measuring at the hand or the wrist is pulse rate. So
and that's why the green light. Yeah, I see what you're saying.
Yeah. So it's measuring the flow, the pulsations of blood flow, and
yeah.
interestingly, pulse pulse rate and heart rate do not have a perfect one-to-one comparison. You can have a heartbeat that doesn't get registered as a pulse, and you can measure a pulse even if it didn't match with a heart rate. So
Wow.
you'll often see, in particular, and there are again published studies on this that show that pulse rate variability under predicts heart rate variability, just because it's a slightly less accurate measure.
Wow.
So where were we? Oh yeah, sleep. So even though it's not necessarily that accurate at measuring exactly how much time you spent in each sleep stage, they're probably better for trends over time. So like if it says you're sleeping, you get an hour of deep sleep every night, right? And then I would not put a lot of money on that exact number. But if it was consistently sort of in the hour range and then it drops to 45 minutes, that's probably a meaningful change. Right, so use it to look at trends and changes in data rather than like absolute numbers, if that makes sense. And then the final part of your question, and use that sort of like integrated over time. Like, is there something that like consistently has that effect on your deep sleep, for example, like alcohol? Although alcohol generally causes a REM sleep deficit, but can generally impact all aspects of sleep. Or caffeine late at night, that definitely impacts deep sleep. So then.
It just blows my mind that there are people that are like, oh, I'm going to shotgun a Monster energy drink and then expect to sleep. Like, of course. Cramming 200 milligrams of caffeine.
There are so many people who are like, oh, yeah, I always have an espresso after dinner, and I sleep just fine.
Yeah.
And, you know, your mileage may vary. There's obviously some individual variation.
For sure.
But so in the final piece, and this is where I think, you know, sort of like the rubber meets the road, and like I've like nerded out on all these different like technicalities around wearable data that probably like most people don't need to know about. But I think the most useful thing to do, and ideally you would give all of these data to somebody else or some kind of system, and it would aggregate it over time and feed it back to you in a much more controlled kind of setting, right? And so the best example that I would have is like when we work with Formula One drivers, I primarily work through a coach who is with that driver every day. They're like holding the helmet, holding the umbrella, they're next to the car, they're doing the drills before the races, they're doing the training, they're traveling with them all the time, they're doing the nutrition, they're there every day. The driver has a wearable, but it's not connected to their phone, it's connected to the coach's phone. They never see that, right? That's the ideal scenario. The coach then can say, we can look at trends over time, and so we have dashboards to help the coaches do this, so that the driver isn't waking up and being like, oh man, I didn't sleep well. And then immediately that has a psychological knock-on effect on their performance. So my suggestion to you is, don't look at your app first thing in the morning. You could look at it later in the day or something like at a point where it's no longer going to psychologically have an effect on you.
That's a great idea.
That's the biggest change that you can make there.
Right, because I have it in my morning routine to do my Whoop journal. Because they prompt you to like fill in like what. Tell me about yesterday. Did you have creatine? Did you have vitamin D? Like that kind of stuff. And I just put it in my morning routine, but I could just put it in my evening routine as well.
Yeah, do it.
That makes so much more
right
sense.
Before or after dinner or something. So like it's not going to stress you out before while you're trying to like wind down for bed again, right? But it's you've done your day, you've done whatever you need to do with your day. You're not worrying about how you slept last night, and then you can kind of disconnect it from that like immediate period of time.
That's great. Something else, Whoop, just a delight in my life. I just love them. I got in early to, and I don't know how much I'm allowed to talk about this, but I did blood work through them or whatever. And one of the things that came back is that, which I kind of knew because his dad died of a heart attack, and my dad has always been all about heart stuff. But I have a dysregulation or something different about my heart or some biomarker that relates to my heart. I can't remember which globulin it was or whatever. And so I'm curious, not about this specific thing and get your personal bias, but I'm just like, that is in my head though. And I'm curious in general when people have these types of things that they're told, because now I'm kind of like, oh fuck, like, am I going to die early? Am I going to have a heart attack early? Like is there research connecting the dots on those types of things and having more data around a thing and then it leading to causing that thing specifically, even with something like as advanced as like a heart attack or something like that?
So I don't think we have really clean data on that, but I think if you look at all the different bits of evidence we have, I absolutely believe that that's sort of like part of the picture. And when you sort of look at the research on getting these kinds of biomarkers, and it's funny because there's a very specific group of doctors, scientists out in the public sphere who are very much like the more data, the better. Like, this is going to empower you. You're going to know all this stuff, right? You can't act on something if you don't measure it. And that's true. But again, like, most people are not rational human beings. Like, that's not how they respond. So there's research where they do things like measure genetic risk for a disease. Alzheimer's disease being the most common, right? You measure your apolipoprotein E genotype, ApoE4. You have 1 or 2 copies of that. Significantly increases your risk of Alzheimer's disease. There are some people who say, this is great. I'm glad I have this information. Now I can act in other ways to decrease my risk, right? There are some people who say, meh, like, this makes no difference to me whatsoever. And there are others who are like, I am now so stressed about my dementia risk that now I think everything we know about the effect of chronic stress on health and dementia risk itself, we've now created a scenario where somebody is stressed about dementia, and that increases their risk of dementia because they're stressed about it. So a lot of it comes down to, how do you as an individual respond to these data? Like, there is no one size fits all response. It's all like very, very personal. So some people feel empowered, right? Some people doesn't even like register. Some people it creates stress. So then you need to think about, well, if I want this information, how do I then mitigate any potential issues that would come off it? So if you're doing a blood test, and I think this is just like important overall, like, regardless of when you're doing it or how you're doing it. And this is one reason why sort of like traditional medical spheres get really mad about these sort of like direct-to-consumer tests. And I understand why, because like, you just get dumped with a whole load of data, and you're like, well, what do I do with this now? And so like, in general, if you're doing a test that's associated with a specific disease, right, sometimes it's useful you have something called a pretest probability. Like, I'm only going to test something in you if it's likely that you have this disease, and now I'm trying to rule it in or out, right? That's not the case with most blood tests, like the ones that you did with Whoop, but that's still important, right? So often I see like blood tests get sent to me, like a driver did a blood test, they did it through some physician in another country, and it's got like a whole bunch of markers on it for like cancer or something. I'm like, well, why did you do this test? This is only useful in somebody who already has cancer. Like, and I know this person doesn't have cancer. Like, why would you test this? So like, sometimes it's like, should I even have done this test in the first place? And then another one is, am I testing for something that I can actually do something about?
Oh, yeah.
So again, so if we're thinking about cardiovascular risk, there are lots of things that contribute to cardiovascular risk. Some we can't do things about, right? So like, yet. So one example is lipoprotein a is relatively fixed. It's quite genetic.
That's the one. That's the one. That's the one that is messed up in me.
Yeah. So the current approach is to say, well, this is a relatively fixed risk factor, or that there are lipoprotein a drugs that are coming. So like, maybe that's relevant to you at some point, if you want to address it that way. But so then they might say, well, I'm going to make sure that I address other risk factors more aggressively in order to like counteract this particular result. And again, that's a personal choice. So you might be more willing to take a lipid lowering therapy like a statin or something else, because that helps to reduce your overall risk in that picture. But then you might also think that other risk factors we know for cardiovascular disease are super important, that you can have an effect on, like blood pressure, blood sugar, these other things. You can act in other areas to kind of counteract that. So again, it's just knowing like how you only test something if you know there's something you can do about it, if you find a specific result. So like, all of that then becomes important, because right, the psychology is like really key to how you then act on that information.
Right. Yeah. I mean, and not to rag on Whoop or anything, because they did absolutely, they're like, okay, here's your results. And then they have a clinician go through it and give you, here's what I would do. And now I'm taking more omega-3s, like I'm doing more zone 1 work. Like I've made they didn't just leave me high and dry. So
yeah, no, I know they don't do that, because I know some of the guys who built that platform. So I know like they don't do that, but there are other groups where you just get a whole bunch of data and then like, hey, you're on your own. Like, figure it out.
Good luck. It's crazy. Yeah. Yeah. That's a wild time. When we're thinking about something I'm curious about, this is completely off the beaten path here of what we are talking about, but I want to talk about, before we dive into something you said earlier about how you make recommendations to these elite performers, something that I see stresses people out the most in relation to the chronic stress and stuff like that, at least in the work that I do, is like this feeling of enoughness, enough success, enough money, enough this, enough that. Like, how do you navigate that? How do you advise that? How do you think about that and talk about that with yourself, obviously, but also these elite performers that are like, their entire life is about more and more and more and more. Like, Like, how do you think about that or conceptualize that?
So I think that the best like athletes who have consistently successful careers focus a lot less on the outcome and a lot more on the process, right? So, and that also relates to a little bit to sort of like the immediate feedback, the thing that you were talking about earlier. Like we're talking different timescales here, but it's still relevant. So you can't guarantee in elite sports, you can't guarantee a certain outcome. So imagine. This is another example that I use in my book, actually. But imagine that you're sprinter in 2012, right? You go to the Olympics. There were 5 or 6, in the process of the men's 100-meter competition, there were 5 or 6 people who ran national records. There were those guys who came second, third, and fourth ran personal best times that any other time would have won, but they're running against Usain Bolt. Like, just shit out of luck. No,
Yeah,
like,
that's the technical term.
Right. So like they had incredible performance both individually and nationally, right? In terms of rankings, like how well they did. But like you're just like up against a phenomenon. So you can't guarantee a win ever. But you can enjoy and become focused on the process of slowly building capacity, getting better over time, and like investing in the processes that result in that. And so that involves like being really specific about like what's the adaptation I'm looking for right now and having very specific training sessions, and like how can I track improvement to that? How can I maximize my environment for recovery so that I make the most of the training sessions that I'm doing? How can I set up my day so that I do really well when I travel and I'm kind of like ready to get in the zone to race? And then another part is how can I create the psychological resilience so that when like stuff kind of falls apart, I can still get on with the job. And this is one of the issues that I have with sort of like the world of optimization, which is that the risk is you create this inherent frailty in your head, which is that I'm going to optimize all these things. That's my sleep, my diet, my exercise program. What happens when you can't do that? What happens when you can't sleep as well as you want to? What happens when you can't eat the way you want to? What happens when you can't do the workout that you want to? When you've created this idea in your head that all of these things are required for optimal function, then when those things don't happen, you won't be able to function optimally because like you're all in your head just being like, well, I didn't get the thing that I needed to do in order to perform well. That's not what we want. We want to create an environment where we can perform regardless of what happens. And we do that by having like consistency in these areas, but like you can't always guarantee you're going to sleep well. And like you're still going to have to show up the next day. I think investing in all those different processes and learning how to do that, those are the guys who like consistently come back and do well year after year after year after year. And so you're not focused on the outcome, you're focused on the process. And right, if you focus on the process well enough, the outcome kind of takes care of itself, as long as you're not running against Usain Bolt. And so then the other part of that, how that translates to the rest of us, is that there are some really interesting studies that look at this idea of enoughness. And again, it's like it's an observational study, it's not a randomized controlled trial, we can't guarantee that the results are real, right? But there are a couple of studies done with data from US populations using data from NHANES plus some other data. So NHANES is the National Health and Nutrition Examination Survey. They do sort of like 5,000 to 10,000 people every year that are supposed to like represent the average US population. They do blood tests, dietary records, they do some physical function tests, they do all this kind of stuff. And they look at like how that relates to future disease risk. Sometimes they're tracking like potential toxins in the blood, like they measure bisphenols or phthalates or like all the heavy metals or something like that. And like every year they have slightly different things that they measure because there's slightly different things they're interested in. There was one or two studies that used sort of like a similar part of this data set where they took people and they asked them, how much exercise do you think you do compared to people like you? And the answer was, about the same, less, or more, right? And then they looked at cognitive function in one study and they looked at mortality risk, like how likely this person is to die in another study. And what they found was that people who thought that they did less compared to other people like them had lower cognitive function and a higher disease risk after adjusting for how much activity they actually did, because they were wearing activity monitors like, step counters and stuff. And they adjusted for a whole bunch of stuff, socioeconomic status, health, the disease risk, all this kind of, they adjusted for a whole bunch of things. So like the way I interpret this is that if you're constantly thinking, I'm not doing enough, right? Other people like me do more exercise. I'm not doing enough. Like, even if actually you're doing a lot of exercise, you have higher disease risks because of this thought process of not doing enough.
Bro.
And there are similar studies in like the stress sphere. So like looking at people, like you can kind of quantify their stresses, and then you ask them, do you think stress, like high amounts of stress, negatively impacts your health? And only the people who have a high amount of stress and think that stress is bad for their health then see negative outcomes from the stress that they're exposed to. There's just like so many examples of not you thinking something about what you're exposed to, or like that you're not doing enough, right? Or too much if it's thinking about the stress thing. That it impacts your health because of how you think about what you're doing rather than because of what you're actually doing.
But stuff like that, I'm like, why would you want to study anything other than neuroscience and psychology? Like, why? Like, I just like, dude, that is so profoundly important to like how we exist as humans. Like, it's just, that's wild. So the way that you perceive your enoughness, or the way that you think about your expectations around your enoughness determine, I wonder how many things that relates to, like how many other things is that true for?
Yeah, and this overlaps perfectly with what I was talking about earlier, with as it relates to social media and social ranking, right? And that, I think, it has a negative effect on many of our enoughnnesses, if that's grammatically correct. You know what I mean?
God,
like
so
constantly, like your enoughness is massively influenced by what you're seeing, in the media, regular and social. And so I think that, right, that's being manipulated in real time by those things. And so like these are older studies, but I think there's probably even a bigger effect that's possible now because of the sort of the things that we can see on a day-to-day basis.
Dude, without a doubt. It's interesting, like a day-to-day experience I have, because I'm a creator. I have almost like just under 1 million followers across my account and stuff. And new creators will come to me, or people are thinking about, oh, I want to start making content. One of the biggest things I hear all the time is like, well, I don't have a bunch of followers, so people aren't going to listen to what I have to say and stuff.
Yeah.
And it's like their expectation around that prevents them from taking the action or posting and stuff. And a myth busting move that I do is I open their phone. I'm like, okay, let's go to Instagram and just open up your Reels tab, because people are doom scrolling, right? And I scroll, I'm like, how many followers does this person have? I have no idea. And I scroll to the next one. How many does this one have? I have no idea. How many does this one have? And because when you're doom scrolling, you're not looking at the profile. You don't see the, right? But they expect that people are going to know that they have no followers, so they don't take the action. And then the second that they don't, all of a sudden they're posting every day. And it's like, and so I want that has to be in the realm of what we're kind of hitting on here in relation to their expectations.
And it's funny because when you're in that scenario, you're kind of doubly affected by the fact that you're seeing other people post and you're not doing it, right? Or you're seeing other people have more followers and you have less. And all of that contributes to that same kind of not feeling of enoughness, because of like, it's not just how you feel about yourself, but also what you're seeing from other people and then how that projects back.
Man, that's wild. Earlier you mentioned that we barely know anything about neuroscience, which is one of my favorite topics of discussion, to be honest with you. And it's also awesome. Neuroscience is my favorite too, because it's the only field that studies itself. Like, your brain is literally studying itself, and that is neuroscience, and that is fucking awesome. But in relation to not what we don't know, are there any things that you've seen that you're like, okay, that we're probably going to change our perspective on that? That's going to be vastly different. Like, is there anything like that, like cutting edge stuff?
Yeah. So you're potentially cutting edge, at least from the way that I've seen it develop over the past 10 years, say 10, 20 years since I, went to medical school just over 20 years ago. I got my PhD just over 10 years ago. When I think back, we probably thought two things about the brain as it relates to sort of long-term cognitive function. One was that there's basically nothing we could do about it. You're going to get to 30 years old and then it's just like this slow, steady decline into dementia or not, but you really have no influence over that trajectory.
Which then goes into the whole expectation we just talked about and just made it probably worse.
Yeah, 100%. So, right, I'm going to go off on a tangent for a second, but this is a really nice area where like Ellen Langer does amazing work in expectation and how that affects like our health. And she talks about this thing called stereotype embodiment theory, which is that if we have a stereotype about something, so here like aging and cognitive function, we will then do the things that cause that thing to happen, but it didn't need to happen. So like as you're getting older, you're like, well, I'm going to start to remember things less well. I'm not going to be able to learn new things. I'm not going to be able to do difficult things. For cognitive function, for physical function, like I can't lift that heavy thing. I'm too old. I'm going to get injured. So we stop doing the things that help to maintain, right? We think you lose function as you get older. as a result, you stop doing the things that help you maintain function, and therefore it becomes a self-fulfilling prophecy, right? You lose function as a result.
Dude.
So, like, so
100% agree with this. Like, I
Yeah.
totally see this.
So we used to think, right, there's nothing we could do about the trajectory, and then because of that, we probably made that come true, right? Because we didn't do things to try and change that trajectory. But we know that's not true. We now know we probably have a significant amount of control over our cognitive trajectory. And then the second one, related to, so particularly Alzheimer's disease and its treatment, there was always going to be some drug that was going to decrease amyloid in the brain, and that was going to be a cure for Alzheimer's. We've seen that not come true. How many times do we need to see that? Like, some of the more recent therapies may help to change the trajectory slightly, but I think if you're actually going to address that, you're going to need to come at it from multiple angles. I think we've become too hyper-focused on one particular protein and sort of cascade, the amyloid cascade, as we think about it, amyloid and then tau and all that kind of stuff. I'm not saying those aren't important. I'm just saying they're just one piece of the puzzle. And so those are kind of the two things that I think we are starting to change our minds about. And like 10, 20 years time, we're going to look back and we'll be like, why did we ever think that? Like, we know it's much more complicated than that. Or we know we have much more control here if we sort of think about the environment and our lifestyle and that kind of stuff. So those are the areas that I'm very interested in because I'm sort of like actively working.
Dude, two things. This is why, to point number one, this is why I actively, on my website, have a 200-year vision published. Because I am not going to expect a life expectancy of 75 fucking years old. So let me just tell you, everyone who thinks I'm crazy, come talk to Dr. Tommy. Number two.
I'm not sure you're going to live to be 200 years old, but I respect the vision. Don't get me wrong.
I appreciate it. I just don't want to expect a shorter life is really where I'm trying to get, trying to get. I'm being hyperbolic because I'm slightly crazy. In relation to the second point, it's the plaques and all that kind of stuff. I'm sure you're familiar with like the nun study, like the hyper social nuns that had all of the plaques and all of the buildup that should have said, well, you have dementia and Alzheimer's, but they didn't exhibit the symptoms and stuff. That, because I saw that when I was coming up through like learning and like getting my degree and stuff. That study was already alive. And I was like, oh, okay, well then maybe maybe it's not all about the plaques and stuff. Like, could you expand on that or tell people more about that? Like, I'm sure you know this better than me.
Yeah, sure. So I guess just like, we'll step back just like for a second. And if we think about dementia is essentially a clinical diagnosis of getting to a point where you've lost so much cognitive function that you're unable to care for yourself in a normal way on a day-to-day basis. There are multiple different types and causes of dementia, many of which do have overlap, but the most common is Alzheimer's disease, something like 70 to 90% of cases of dementia. The next most common is vascular dementia. So this is issues with the blood vessels in the brain. Between them, they make like 70 to 90% of all dementias. And there's also, like, when you have Alzheimer's disease, you usually have some issues with blood vessels in the brain at the same time. Like, they're very difficult to like completely separate. But what you see in Alzheimer's disease, and this is like a whole story related to Alzheimer himself and the dementia cases that he studied in the early 20th century. But basically, you see this accumulation of one protein called amyloid into these plaques. So they used to call them miliary bodies because it looked like millet seeds in the brain. So like this like clump, like sort of like circular clumps of seeds is what it looked like under a microscope. And then that precipitates, according to the amyloid cascade hypothesis, changes in tau, which is a cytoskeleton protein in neurons that become hyperphosphorylated. They become kind of like tangled. They call them tau tangles. It's like a bunch of like spaghetti that's kind of like been clumped and wrapped together. And these things then precipitate the death of neurons. And as you lose neurons, then you sort of lose function. And other things happen, like you get microglia, which are the immune cells in the brain. They have this immune response, and like all these other cells in the brain become important here too. But there's no amount of amyloid in the brain that says this person has Alzheimer's or not. There's no amount of tau in the brain that says this person has Alzheimer's or not. The amount of amyloid you have doesn't perfectly predict the amount of tau you have, and the amount of both those things that you have don't perfectly predict your cognitive function or your trajectory of cognitive decline. They are correlated, right? So like more protein on average, lower cognitive function, more likely to get dementia, right? But the data are very messy. And so this has brought about these ideas of resilience and reserve. So resilience is, can my brain tolerate the accumulation of these proteins such that I don't lose function? And reserve is like how much additional cognitive capacity and essentially brain volume, like more brain is better. Like how much extra capacity do I have so that if I do start to lose some capacity, I can still function pretty well. And so they've basically generated these ideas in order to help explain the variability in the relationship between amyloid and tau and dementia. But I think that the things that relate to reserve and resilience are probably much more fundamental in terms of maintaining the structure of and function of the brain. So things that improve reserve include, good nutrition, physical activity, and things that improve resilience include like education and skill development. And so the nun study was the classical example of this, because the ones who like their brains just look like, well, this person should have Alzheimer's disease, like it's just like stuffed full of amyloid, and they didn't. And it's thought that it was because they're very socially connected, they have a lifelong goal of learning, and then as they transition into higher states within the group, so like some of their like higher sisters, they have a role of teaching. So like that's like they're constantly engaged and they have purpose and they have a job for like their entire time within the group. And so like all of these things we know are important both for resilience and reserve, which again just says that how we engage with the environment is this major determinant of how our then brains function. Even if like you look at it under a microscope, you'd be like, how does this brain work? I just don't understand. So it's these other factors that I think are playing a dominant role in terms of the actual things that we care about, which is how we can function in the world and engage with it.
I love the brain. There's just so little we know about it, and there's so much that I love it. You mentioned microglia too. That's a whole separate thing. That's my favorite brain cell. Microglia. Oh, yeah. My favorite brain area is the hypothalamus. Like I love the glial system. Like it's just people don't even realize how important that is. I digress. We don't have time to go there. The question I would love to ask you now, in relation to how little we know about the brain, no, I'm kidding, is you mentioned earlier that you are kind of the dude that's like, hey, this is something that makes sense or this doesn't make sense for like high level people, like supplements and processes and tools and things like that. What's your methodology or your framework that you use to qualify things that would make sense for an athlete or a high level performer versus not? Like, what's your bullshit detector is what I'm trying to say.
Yeah. So particularly in that environment, you have to have a really high threshold to deploy something for a few different reasons. The main one being that these guys just don't have that much time. Like they're already at their limit. They're constantly traveling. They're in a new time zone every week. Like when they're not driving the car, they're in engineering meetings, doing media stuff. They're meeting with sponsors, right? So if I'm going to suggest that they spend a significant amount of their time doing something, I have to be fairly confident that there's going to be a significant return on that investment. They will often and they're actually pretty good at this, and probably because they're constantly being pitched and sold stuff. Because the minute that you have one Formula One driver who has your device, you can be like, oh, this is used in Formula One. Like, even if he never actually picked it up or used it, right? If it's in his house somewhere, you can use that as a selling point. So the things that kind of come into play are like, what is the thing that you're trying to achieve with this given whatever it is, right? Is that something that you need in order to improve your performance? And like each individual athlete has very different needs as it relates to sleep, as it relates to training, as it relates to the data we might want to collect, nutrition. So you need to understand the athlete well and understand their needs. Understand, so if we go back to being focused on the process, what part of the process are they trying to improve here? Then what's the likelihood that this thing is going to move the needle on that? And sometimes you have to acknowledge that, the placebo effect plays a role here. If my guy is really struggling to recover or relax, and I've got something, there's some new technologies, and there are lots of technologies in that space now, where it's like you can improve HRV this much, or you can improve sleep this much. If they feel good using the thing and that allows them to relax, and they can kind of, they're more likely to wind down and more likely to sleep when they've been traveling, all that kind of stuff. Great. We don't have to guarantee that this has been done in a randomized controlled trial and it's, rock solid evidence but there has to be enough to say that this is going to make the person think that they're kind of improving that part of the process. So I'm okay with using things that are sort of still at the forefront, as long as it fits into that picture where it's got a high likelihood of achieving that goal, and some of that can be driven by expectation. And everything we use has to be, I use this idea of positive asymmetry, right? So which is high potential for benefit with zero or minimal to ideally zero potential side effects. Like the worst being you spent some time doing something that didn't really have a big effect. So those are all the things that are going into that calculus. What does the athlete need? What do we know about the technology? How is it going to help them improve that part of the process? And often, like, so that the first time I worked in Formula One, and I'd been a Formula One fan for a long time, and I was like, man, I'm going to know everything. I'm going to show up and I'm going to have 100 things. I've got 100 things that we can do that's going to improve performance. And then, like, I'm speaking to all the coaches and the drivers for the first time, and I remember like one coach saying to me, like, we've got time maybe for one thing. What's the one thing that you think that we should do? And then all of a sudden, like, all these ideas just like immediately out the window, and you have to like really then think through that entire process, which is a lot of fun, because it's like it's sort of real time problem solving, applying the scientific method, but also understanding, right, these are humans, figuring out what they actually need, how that's going to support them in their process. But like, those are all the little bits that maybe go into it.
Yeah, that's super interesting. I love the one thing as a concept. I use that when I work with people as well. How would the average consumer kind of apply that methodology to themselves? Or how, maybe start with you first.
Yeah.
Because there's not as high a stakes for you necessarily as a Formula One driver. Like, how do you determine, because I like that asymmetry thing. That's an interesting concept. I feel like anyone could use that, but how else would you, average consumer, kind of apply this and learn from these high level athletes?
Yes. So one final thing that I didn't really mention is that to a certain extent, we have quite a lot of constraints in that world, which I think are actually a good thing. So particularly as it comes to supplements. So to use a supplement in that world, it has to be third-party tested to make sure that it doesn't have banned substances in it, which dramatically decreases the toolkit, which I think is actually a good thing, because then you end up being much more targeted in your recommendations. In other areas, you might go to some performance specialist or physician, and like, you get a laundry list of 100 supplements that you have to take, right? Of those, I could maybe use 4 or 5 in that world, just because it has to be NSF for sport or Informed Sport or similar tested. And some athlete, you can get this done yourself, right? So if there's a supplement you really want to take, you can pay a company to test it for banned substances, but it's expensive, right? You're spending thousands of dollars to take a $50 supplement or whatever. But sometimes the calculus is worth it for the athlete. But I think it's a constraint, but a useful one, and actually might be useful for the consumer as well. So particularly if you're thinking about supplements, you should be able to get a certificate of analysis from the company that you're buying a supplement from, which means that they've sent it to somebody and like tested it for heavy metals, bacteria, a few other things. They might not test it fully for banned substances, but you want to make sure it doesn't have a bunch of stuff in it that you don't want to be there. And ideally that they've measured the concentration of the thing that you're taking, so that you know that you're actually getting what you're taking, right? Any company that you email and say, can I have a certificate analysis for this batch of this supplement, and they don't have anything for you, move on, hard pass. That's not a supplement that you want to take. So like that's a simple way to kind of navigate some of this stuff. But then sort of stepping back, the way that I think about this, and I'm going to focus specifically on brain health because we're talking mainly about the brain. And so if you think about like, what's the one thing that maybe I institute here? I have a model in my head for how the brain works, right? And like, having already told you that I don't know how the brain works, you might be skeptical, but I'll tell you, hopefully it makes sense. And it is well grounded in what we know about what our physiology requires in order to maintain and achieve maximal function. So I call this the 3S model. The first S is stimulus. So this is like a lot of what we already talked about. So how you use your brain determines how it functions. So learning, social interaction, complex skill development, these are the primary determinants of brain function. So anything that you do in that world is going to provide a stimulus to improve network stability and, multiple different cognitive functions in a way that probably transfers across multiple areas of life. So we know that people who have higher educational attainment, people who learn complex skills, that improves their cognitive function and slows cognitive decline if they continue it lifelong. So that's the stimulus bucket. Then the next bucket is supply. So when you stimulate an area of the brain, it requires additional blood flow. There's this thing called neurovascular coupling, where the neurons and the astrocytes stimulate the local blood vessels. That draws in more blood. So you need a healthy vascular system. And we've talked a little bit about cardiovascular disease, but you need those blood vessels to be pliable and responsive and all that kind of stuff. So that's where things like cardiovascular fitness and addressing cardiovascular risk factors is important. You also need a supply of energy to come in that blood. And oxygen, but probably glucose for most parts of the brain, but it can also be other things like ketones and lactate, right? So you need some kind of consistent energy supply, and that's where metabolic health avoiding things like prediabetes becomes important. And then you need a supply of nutrients that actually build the building blocks of those parts of the brain that you're trying to develop. So omega-3 fatty acids, super important for developing synapses as well as mitochondrial function. B vitamins in order to kind of regulate where those omega-3 fatty acids go. We know that vitamin D is really important for regulating neurotransmitter production. We know that iron is super important for white matter. Those are probably the big ones, but like magnesium is important too. Polyphenol antioxidants seem to be really important for like long-term cognitive health. So those come from, berries and coffee and tea and things like that. Colorful fruits and vegetables. So that's my supply bucket. And then there's the support bucket, which is the third S. So you've stimulated an area of the brain, you've brought in the resources that you need in order to respond to the stimulus, and then, ideally, the brain adapts after in order to improve function. Just like if you're going to go to the gym and lift weights to get stronger, you don't get stronger while you're in the gym, you get stronger while you recover afterwards, right? And the brain is essentially the same. So that's where sleep is critical. That's when most of that adaptation happens. But we also need some like support, additional support from like other hormones and proteins. So like trophic support we might think of. That's things like brain-derived neurotrophic factor. That's like hormonal status, which are an important part of exercise and physical health. And then we want to avoid things that impair adaptation. So chronic stress is one. That kind of prevents the brain from fully down-regulating and being able to repair and adapt, as well as like some things in the environment that can impair that process. Common ones being smoking, air pollution, excessive alcohol intake, stuff like that. So that's the support bucket. Then when you're thinking about like, well, what's the one thing? Like, I think it's really important that when we go out into the world and we look at social media, like something that you'll frequently see is, here's 20 things to do for your brain health. And you're like, well, if I think about doing 20 things, I will do 0 things. That is usually the way it goes. And actually, if you think about doing 2 things, you'll end up doing 0 things.
Paradox of choice.
Yeah. So the reason why I talk about it in terms of those 3 things is because they're also, like, these are common mechanisms that are important for brain function, but they're also interconnected. So when you stimulate the brain more, you have greater sleep drive and you sleep better. And there are studies in older adults where they do cognitive training, and because they've used their brains more, they sleep better afterwards. And so when you change one thing, you change everything. And that means that you can actually just focus in one area. Similarly, right, if you improve sleep, then you become more social. You decrease your blood pressure. You decrease your blood sugar improves. Like when you change one thing, multiple areas of the network kind of shift. So a starting point is then thinking, in all those different buckets, is there something that Tommy just said that I identify with? Was like, oh yeah, I could do a little better there as it relates to diet or as it relates to skill development. I haven't taken a new class or tried to learn a new thing or done something that I'm bad at and tried to get better at it anytime recently. Like that's maybe where you should focus. Or, I don't consistently sleep more than 6 hours, so maybe I can try and find 15 to 30 minutes of extra sleep opportunity so I can slightly improve my sleep, right? And then when you change one thing, the whole kind of network shifts. So that's the way that I think about it, is like, where's the biggest bang for my buck? And then acknowledging that if I start to make small changes in that area, actually I'm improving multiple areas at the same time.
It's beautiful because it's like the one action they could take. And then the other thing you're essentially saying is like priming their expectation for it to have that downstream effect on all other systems. And as we've been talking about, expectations are so important.
Yeah, because what happens on the other side of that, and what I see much more frequently, is you see something like, you need to sleep 8 hours a night or you're going to get dementia. So then somebody, and that is out there, even from like very well-respected sleep scientists. So then if you're somebody who sleeps 6 hours every night, and you just like, I've got a job, I've got kids, I am not going to sleep 8 hours a night. What's the point of me trying to sleep 6.5 hours if I know I'm not going to see a benefit until I hit 8 hours? And so that then stops them changing their sleep at all, when actually that additional half hour could have a massive impact. And it's the same, like you often see, you need to do 4 hours of zone 2 every week in order to see benefit for your fitness. And we're like, I've got time for 1 hour, maybe, right? So I'm not going to do any, because I'm never going to achieve that lofty goal of 4 hours. But we know that with physical activity, any increase above what you're doing right now significantly improves cognitive function. So it's really important to acknowledge that even small changes in something where you've maybe got some work to do can have a big effect. And if we think of it the other way around, that we've got this lofty goal that we'll never hit, we're never going to change anything. And as a result, we won't see any benefit.
Dude, I use this all the time when I work. I've helped a lady lose 250 pounds. Nutritionists couldn't figure it out. Dietitians couldn't figure it out. Exercise scientists couldn't figure it out. She's like, no one can help me. And all of them wanted her to start doing 45 minutes of exercise every single day, change this, change that. I'm like, screw that. Like, can you start doing one push-up a day?
Yeah.
And she's like, she thought I was messing with her. She
Yeah.
kind of got mad at first, but I was like, no, I'm being so serious. And she's like, okay, fine. Yeah. So she comes back a week. And I was like, did you do one push-up every day for 7 days? She's like, yes. I was like, when was the last time you told yourself that you were going to do something and then followed through consistently? And she's like, holy shit, it hasn't been 20 years. I'm like, so you just became the kind of person that does this. Yeah. And that globally changes her identity, which changes her expectations, which changes her ability to feel motivation. And surprise, surprise, the next 2 weeks, she's like, oh, I'm going to do 10 push-ups now. And slowly became the kind of person that did that.
Yeah, 100%. Yeah.
So I think, I don't think that that's talked about enough.
No, absolutely not. And this is the problem with, I think this is the problem with most like health podcasts and health information. It's very well-meaning. Right? We know this stuff is important, but you create this huge list of things that people can never achieve. And as a result, they think that they are incapable of doing the things that they need to achieve health. And so they never even try.
I couldn't agree more. That's why in 2026, actually, this is an interesting like personal change I'm making is I'm creating a list of books I'm going to reread every year instead of a list of books that I want to like new things I want to read. And I'm like, it's forcing me because I only have so much time. So it's forcing me to choose the new books I will read and rereading the ones that I want to read and applying, actually doing. Implementation is what we need today, not information.
We're
so
my good friend Andy Galpin says that we have an overload of information and minimal insight, and I think that really sort of summarizes where we are with sort of like the health information space right now.
Yeah, dude, I'm freaking with you. All right, well, it's been a wild ride so far. We like to ask a couple final questions to our guest when they jump on here. One, I think is going to be fascinating to ask you is what is an important truth in your field that very few people agree with you on?
Yeah, I think they're probably ones that I mentioned earlier, right? It was like the things that I think we're going to change. So as it relates to the capacity we have to change our cognitive trajectory across the lifespan, and then how that relates to our dementia risk, I think that it's coming. So I won't say that like very few people agree with me, but like I speak to, and I have colleagues in cognitive neuroscience, cognitive psychology, neurology, and I start talking about like, hey, if we can get people to like do a little bit more exercise, we can dramatically decrease dementia burden at a population level. That kind of stuff, which I absolutely believe to be true, I think is still fairly mind blowing to people, and that's why I'm very excited to talk about it. And then the other one, again, I've mentioned it already. As it relates to the kids and the developing brain, being that you have like there's so much impact of the early environment on brain development, such that even if you had like a less than ideal start to life, you had spent a bunch of time in hospital, you were really sick, maybe even had a significant brain injury as a baby. Actually, we now know more and more that there's a huge amount that can be done as it relates to stimulating that brain, feeding it, giving it a social and supportive and loving environment. You can have a massive impact there. So again, I think the main thing is that like neurology and neuroscience aren't nearly as deterministic as we once thought they were, and we have a huge amount of agency in that process.
A myth that in that vein that I get hit with a lot is the neuroplasticity one, that it just will not die, that you're only plastic from until you're like 25 or 20. I can't remember the number. Please expand, because I 100% agree. I shout it from the rooftops. It's almost as bad as your right brain or left brain, which I just want to run into walls thinking about. But the neuroplasticity is the most important one. Please expand on this, because this is a very powerful belief to hold as far as expectations go.
Yeah, so I think where people get confused is thinking about neurogenesis versus neuroplasticity, right? They're not the same thing.
Yeah,
so neurogenesis is making new neurons. In the adult human brain, there are probably only a couple of parts of the brain that generate new neurons, and they do it throughout their entire life, but it's the olfactory bulbs, so the part of the front of the brain responsible for smell, and a part of the hippocampus called the dentate gyrus, right? Other parts of the brain, you're not making new neurons. But it's also interesting that you're not losing neurons as much as you think you are. So we used to think that as you get old, you just like start like losing neurons, they start dropping off. What happens actually is that they start to decrease in size. So like as your brain shrinks as you get older, which does happen on average, you're not losing neurons. Those neurons are just like kind of losing their size. It's kind of like your muscles kind of lose size if you stop using them. But they're still there. They can still be functional if we continue to stimulate them. So like they're just like ready to be reactivated as soon as that stimulus comes in. But neuroplasticity is essentially the capacity for making new connections between neurons and like building certain networks associated with a different functional skill. Adults can learn at any age, and even Ramon Santiago y Cajal, who like discovered neurons essentially, right, at the end of the 19th century, he
The
even
OG.
said, right, yeah, although I mean, because you're a fan of Glia, obviously you have to be a fan of Camilo Golgi, and that was like a right, that was the big, that was the original neuroscience feud, right? They shared a Nobel Prize but refused to speak on the same day because they disagree with each other so much about the structure of the nervous system.
Damn.
Anyway, I digress. But even like Cajal was saying, the changes in connections between neurons explain learning, right? So he was talking about neuroplasticity before you could even measure it, because he was just looking at slides under a microscope. And so the brain is capable of making new synapses and pruning synapses. And actually, learning is often about pruning synapses you don't need at any age. And the only time when maybe you've lost that capacity is once you actually reach full dementia. So like many people consider dementia to be a fundamental loss of neuroplasticity. That says that at any age where you don't have dementia, you are capable of neuroplasticity, essentially, like because it works in the other direction. But anytime you learn anything, and older adults are perfectly capable of learning, we've done dozens, if not hundreds or thousands of randomized controlled trials to show this, your brain is undergoing neuroplasticity. So the brain is always neuroplastic, maybe not in like these sort of like final states, although there's a possibility we'll get to a point where we can reactivate neuroplasticity in those brains. We're not there yet, but I'm hopeful that it will happen someday. But yeah, this idea that the brain isn't plastic later in life is just completely incorrect.
I love that. Do you think it would help? Well, two things. Do you differentiate between synaptic plasticity and neuroplasticity? And if you do, maybe synaptic plasticity would be a better word because it doesn't get confused with neurogenesis.
Yeah, that's a great point. I don't differentiate it, but that's generally because when you're talking about neuroplasticity in that context, you're talking about synaptic plasticity because you're talking about new connections or regulating connections between neurons that already exist. But seeing as those synapses are on neurons, I mean, they are essentially synonymous in that kind of context. But that is that's a good idea. Maybe we need to rebrand neuroplasticity so people stop thinking about it as being just about growing new neurons. But I will say it's also a big part of this problem is we're so neurocentric as it comes to cognitive function. But neurons only make up about half of the cells in the brain, right? So, right, then you've got microglia, oligodendrocytes, astrocytes, the blood vessels, right? The brain is essentially seeded inside this incredibly complex vascular network that lets the whole thing run in the first place. And so when you see, again, studies where you do some kind of intervention in an older adult, it could be an exercise intervention, it can be like some other skill development, it could be dancing, right? You see changes to the structure of the brain. That doesn't mean that new neurons were grown, but there's a whole bunch of other junk in there that like is really important that you can still improve and modulate and grow, and like you have a better extracellular matrix that kind of better supports the function of those neurons. So there's so many other parts of the brain that are critical for brain function that don't require you to grow new neurons. That I think part of the reason we have this expectation that the brain isn't capable of change late in life is because we're so focused on the neurons themselves. When actually astrocytes and microglia and all these other cells, they can proliferate and they can continue to grow even very, very late in life in order to support or adapt function.
Do you mention oligodendrocytes and like Schwann cells and like myelination? Yeah. Is myelination something that can, like synapses can grow and prune and things like that? Can you lay down more or less myelination and things like that?
Yes. So a good example, so like just to, again, quickly orient people, the white matter of the brain, and humans have more white matter than any other species, about 60% of the brain in humans. It's essentially a very tightly wrapped fat around neuronal axons that allows them to transmit information much more quickly. And so the white matter kind of sits underneath the wrinkly outer cortex and kind of like penetrates up into it. And then like underneath that white matter is some of the other like deep brain, deep gray matter. You mentioned the hypothalamus as your favorite point. Like the hypothalamus is kind of like underneath the white matter. But the white matter is critical for sending fast communication between all these different areas of the brain and the body. The change in white matter structure and integrity as we get older actually better predicts cognitive decline than the accumulation of amyloid protein in the brain.
Damn.
And you can see a much more steady and consistent relationship. Again,
that makes sense. I feel like that makes total sense now that you've said that.
And there are some nice studies that show that. Again, doesn't mean that amyloid is not important. It just means that other things are important too. And so what we've seen, and the best example I have of this is studies of resistance training. So there are 2 or 3 studies now where they take older adults in a randomized controlled trial, and when they do resistance training, they see improvements in integrity and structure of the white matter, and with that you see significant improvements in cognitive function, particularly executive function, which white matter is really critical for. And this includes potentially reversal of something called white matter lesions, which we accumulate as we get older, which are basically pockets of areas in the white matter where you start to kind of see some damage, as sort of, and damage kind of accumulates as part of the process of aging. That may be reversed with resistance training. Why that's, at least partly, and why that's thought to be the case is because of the things that get released during resistance training, potentially the most important being IGF-1, so insulin-like growth factor 1, which, if you study the developing brain like I do, one of the reasons why newborn babies who are born preterm have issues with neurodevelopment is they develop less white matter, or they have white matter injury, and it's because they lose IGF-1 supply from the placenta. So IGF-1 is critical for white matter throughout the entire lifespan, and one way to support your white matter as you get older is with resistance training, because your muscles release IGF-1 when you're lifting weights.
I love that. All right, beautiful. I love the I don't know if you ever had this analogy when you were coming up, but I had a professor that took us outside, and I was like, okay, Dr. Brown, what are we doing outside right now? And he had this hose that he had poked a bunch of holes in or whatever, and he turned on the thing, and water was shooting out from all over it, and the flow at the very end was bad, was like there was no flow.
Yeah.
And then he took some duct tape, and he wrapped it around the hose to cover up all the holes, and the flow increased. And he's like, this is myelin.
Yeah.
And I was like, oh my God, I totally get it now in relation to, he's like, the hose is an axon.
Yeah.
Duct tape is myelin, and the flow out the end is like how much better, faster or slower your neuron can fire. And I was like,
yeah, that's a great
that
analogy.
was genius, Dr. Brown. Thank you. Shout out Dr. Brown, just a Brown. But that was something that I think about. And it's beautiful to hear that we can put more of that duct tape around our neurons and axons as we grow, especially, it sounds like, with exercise, which I'm a big fan of.
Yeah.
Cool. Sweetness. Well, I appreciate it. And I appreciate you hopping on here. Is there anywhere you'd like people to go to find you or find more of you? Well, put your website in the description, obviously, but anywhere else?
Yes. So usually when I do podcasts and stuff, they get posted on Instagram. So at Dr. Tommy Wood is my Instagram handle. Right now, I mentioned my book a few times. So if you're interested in like some of the history of neuroscience that I talked about, some of like how to do exercises as it pertains to the brain, how like the model of the 3S model, like all of this, stress and sleep and all these things covered in detail in my book that comes out in March, called The Stimulated Mind. Pre-orders are super helpful, so if people are willing to kind of order it a little bit in advance, that really helps me. If you're interested in that, would really appreciate that. You can do that wherever you buy books, or you can go to thestimulatedmind.com, and all the pre-order details are there. Once the book is out, then thestimulatedmind.com will be where all the references from the book are housed. I basically have 2,000 papers that are referenced in the book, and they refuse to publish them all because like it would add 150 pages to the book. And my editor was like, I just can't afford to add this many pages to the book. Also, it would have been a significant weapon because it would have been so heavy. So then if people are interested in the science, like all of that stuff's going to be there. And then the final thing is that I have a Substack and a podcast with a friend of mine, Dr. Josh Turknett, who's a neurologist, called Better Brain Fitness. So you can go to betterbrain.fitness, which will take you to the Substack, and all the podcasts and kind of stuff is on there. And we nerd out on all these things on a weekly basis. So if you're interested in that, please sign up there. You can sign up for the Substack is free, so you don't have to pay for it.
Beautiful. 100%. Okay, we'll put links to all this stuff. I'm going to get a pre-order. It sounds like I love this this model that you gave us. And if that's expanded upon, I would love. I've got so many neuroscientist books on my little shelf over here. Dr.
It's an
Ben,
occupational hazard. I know how you feel.
Love it. I'm here for it. I mean, I love it. I am no shade at all. I love it. But we'll put all those links in the description below. And again, thanks for spending some time with us. That's a wrap for this episode of the Decision Lab. If you guys enjoy this no BS approach to science, make sure to hit the subscribe button, and we'll see you next time. Peace.